All right, next we have a presentation from Ray Hino, CEO of the Bear Valley Community Healthcare District, with an update on the fiscal, operations, and capital project his organization is working on. Mr. Hino, welcome.
Thank you, Mr. Mayor, and thank you, members of the council and Mr. City Manager. I really appreciate the opportunity to be here. I have to admit I was a little bit overly ambitious in terms of the amount of material I wanted to cover tonight, so I will get through this quickly, and as I see that you have a very busy agenda for tonight. So what I plan to cover is just a brief introduction to our district, a little bit about the last 12 months in review, what's new and what's next for our district. I'm sure that you're very familiar with our board of directors, Barbara Willey, Donna Nicely, Barbara Espinoza, Christopher Fagan, and Sarah Russ. We're very blessed with an excellent board of directors who have really set us on I think, a very firm path for success in the future. We have some new faces on our senior management team. I'm joined tonight by Marcus Armstrong in the audience. Marcus, raise your hand. Marcus is our new CFO. We also have a brand new director of HR and many of the other familiar faces, including Mary Norman, that I know you all are very familiar with. But we're assembling an excellent senior management team, which I'm proud to be a part of. You're very familiar with all of the many various services that we offer at the district. As you know, we're about a $18 million operation here locally in the community. The hospital's been in business for, next year will be 40 years. So we'll be celebrating our 40th anniversary. And I'm sure we'll be back to tell you more about that. Just briefly, the last year in review, we were a co-sponsor with the Lions Club and the annual health fair. If you missed it, you missed probably one of the best health fair events. It was held at the Elks Lodge this year on July 13th. Large event, very well attended, and we are very proud to be a part of it. One of my most proudest moments in the last 12 months, I believe, was the financial summit that we held on April 16th of this year. The purpose of the summit was to be transparent to the community, to let you all know what our challenges are and what we're doing about it. It doesn't take a lot of time to absorb this graph. It is actually, it's a graph that shows the profitability and the declining profitability of our district over the last 10 years. And so we're obviously in a position that we need to react to that. As a result of declining profitability, our cash and investments have also declined from a high of $12.5 million just a couple of years ago in 2010. And in the last 12 months, our cash and investments have reached down to $4.5 million at the end of September. The topics that we covered at the summit included our revenue enhancement opportunities, which I'll touch on a little bit further detail in a minute, and our expense reduction strategies. As I'm sure you're aware, we did have a reduction in force in May of this year, which did have a desired effect on the profitability of the district, which I'll be able to show you in a moment. Government cutbacks have affected our district, as all governmental entities, I think, have experienced over the last couple of years. Fortunately for us, the legislature and the state government stepped in and did provide some relief to small district hospital like ours. A 10% cut on Medi-Cal funding for distinct part nursing facility payments was taken off the table just a couple months ago, saving us $300,000 in the upcoming year. This is kind of a busy graph. It is the profitability for the district over the last 15 months. What I would try to point out to you is that, I think I have a pointer here. There it is. Okay, so the summit took place in April of 2013. As you can see, some declining performance there. I'm not going to take credit and say that the very next month we jumped up to record profits. There are a couple other things that were going on that month, including some annual payments and tax receipts that we received. But the good news for our district in light of the last 12 months is, as you can see, the losses have become a lot less than they were for the previous periods. So we have seen quite a bit of improvement. Unfortunately, I have to tell you that we now have the results for the month of October 2013, and it was a significant dip, so indicating that we still have work to do. We're actually continue to be on budget for the current year, having budgeted for losses in the first quarter, but we certainly have work to do, and we certainly would be remiss if we didn't talk about the great success that we had with the Pink Glove Dance video that I'm sure that you're all aware of. We're so proud that the entire community came out and supported our hospital and our district to the effect that out of 108 hospitals nationwide, we came in 6th place in the entire country, #1 in the state of California. There wasn't another hospital in the entire state that was even close. We were almost 21,000 votes. I think the next closest hospital in the state had maybe 5,000. So quickly, what's new? This is a great opportunity for me to talk about the Brenda Boss Family Resource Center, because I'm very proud to announce that we opened for business today. Today we saw, I'm told we had 19 walk-in patients today. I know that our goal was to schedule lightly because we're still working out the kinks, but the project will come in probably just under $5 million. It's a very significant venture for us. The outpatient side of our business has experienced dramatic growth, 26% in the last 2 years. That building will house the Family Health Center, the Mom and Dad Project, the prenatal programs over at the Big Bear City Rural Health Clinic, and is going to be a major improvement in services for our community for years to come. We implemented electronic medical records this year. The important figure is down at the very bottom, but we received about $940,000 in federal funding to pay for the new system. So we have electronic medical records paid for through federal dollars. We've implemented a telemedicine program, improving services in our community. The biggest area of improvement and growth for us is in recruitment of doctors. Obviously, you can't have a hospital or successful hospital without doctors. We're proud that we brought back a general surgeon, Dr. Santos. We completed a medical staff development study recently which indicated that there is a documented need in this community for 4 more primary care physicians, 1 more general surgeon, 1 more obstetrician, and 1 more orthopedic surgeon. Speaking of orthopedics, I'm also very proud to announce that starting today, we have an orthopedic surgeon on call for Bear Valley Community Hospital. His picture and his bio is up on the screen for you. His name is Dr. Thomas Liu. Dr. Liu, his primary office is down in Hesperia, but he's covering up here 1 week out of the month. He's a University of Pittsburgh Medical Center trained orthopedic surgeon, previous team physician for the Pittsburgh Steelers and the Pittsburgh Penguins. We're very proud and happy to have him on our staff. We've also recently upgraded our radiologist group with a new 9-member group out of Fullerton, California. What's next on the docket for us is conversion to critical access hospital designation. This is a big move for us. The hospitals in both Mammoth and in Truckee, California, supporting the Mammoth ski area and the Lake Tahoe ski area, converted to critical access years ago. We've determined that there's a positive benefit of over $700,000 in federal funding. It has no effect on the services that we offer. We're currently in the pipeline for designation as a critical access hospital pending a state survey. We were implementing swing beds, which is a Medicare skilled service in our long-term care beds. That's about a $500,000 positive program for us. We will become, as a critical access hospital, eligible for preferred funding pricing on our pharmaceuticals, about $72,000 per year. This is a picture of Brenda Boss that I took earlier today, just to give you a sneak preview of what the building looks like. It's as I said, a gorgeous building that you'll really be proud of. We are looking into refinancing that building through USDA because it's been completely paid for out of cash reserves, which should increase our reserves by about $3 to $4 million. Hospitals rely upon contracts with third-party payers, including Blue Cross Blue Shield, Heritage Victor Valley. We're renegotiating those contracts. We're implementing electronic payables. One of the big initiatives for 2014 is going to be looking at an affiliation strategy for our hospital, looking at partnerships with larger facilities. And I've been in discussions and met with representatives of St. Bernardine, San Bernardino Community, Loma Linda, Riverside Community, Good Samaritan Hospital in Los Angeles, amongst others. And I believe, and we're not talking about selling our hospital to a large corporation or system, we're talking about establishing a relationship, because I believe that under national healthcare reform and the future of healthcare, small freestanding district hospitals like ours are in serious jeopardy of not being successful in the future without some type of partnership with a larger facility. We will be talking about a parcel tax election in 2014. The current parcel tax, which costs property owners in our district $45 per year for improved parcels, $25 for unimproved, is due to expire on June 30th of 2015. It brings in over $1 million of critically needed revenue for our district, and so we are currently engaged in a strategy to have that parcel tax probably put on the ballot for the primary election on June 3rd of 2014, and we'll certainly be back to talk to you about more. We have union contract negotiations coming up in 2014. We have 2 labor unions that represent the majority of our employees. The Affordable Care Act is anticipated to affect us in a variety of ways. But I think it'll be positive. I'm looking forward to the fact that more of our residents in our community will have insurance. Finally, the success of our hospital depends on becoming a critical access hospital, emphasizing excellent quality outpatient services and inpatient services, an affiliation agreement, continued quality, efficient and productive operations in terms of financial goals for the district with the profitability improvements that we put in place earlier this year. For the first 6 months, I'm proud to announce that we've saved over $500,000. Projected out over a full year, that's $1.1 million in profitability improvement for our district. And with all of those initiatives, including critical access, swing bed, everything I talked about, for a full year, the potential is for a $3.5 million turnaround. Thank you.
Thank you, Mr. Hino. Any questions for Mr. Hino? Mr. Herrick?
Hi, Ray.
Hi.
I've got one question. It hit me when you were talking about refinancing the building in order to bring your reserves back up. Just a thought, maybe as opposed to refinancing the building and immediately bring it up, as opposed to doing that, taking the payments you'd otherwise would make against borrowing the money and slowly bring it up. Because it's not always a bad thing to use your cash to pay for an asset such as a Brenda Boss building. Just a thought.
Good point. That's something that we'll take into consideration. Appreciate it.
Any other questions for Mr. Hino? Mr. Matthew.
Mayor and council members, I asked Mr. Hino to come tonight to give a demonstration to you what I've witnessed for the past 12 months, and that is a breathtaking, substantial new management of the hospital and the healthcare district. He's been sensational, and the ground that he's covered in that short period of time, and the amount of information we know about the hospital and about the aspirations they have, has just been remarkable. Ray and I meet on a recurring basis, as well as Kurt Madden, and again, to have that kind of leadership in our community, I think is quite remarkable. And again, considering the short time that Ray has been here, the achievements, especially on the medical side, are just phenomenal. So I just wanted to add that for tonight.
Thank you, Jeff. Appreciate it.
Mr. Mayor, if I might.
Go ahead, Mr.
I did have one question. On some of the partnerships that you mentioned with other hospitals, most of them were down in the valley. Are you talking to any hospitals in the high desert, like St. Mary's?
Yes, actually, I do plan to also meet with St. Mary's. They're part of a large system, the St. Joseph's healthcare system, with whom I've had discussions in the past, so absolutely.
Thank you.
Okay, well, thank you very much,
Thank
Ray,
you.
for the presentation, and I just want to add my personal congratulations, particularly on the town hall meetings that you have held throughout the last year. I think those have really laid a foundation of trust with the community, and as you know, that's something that's sometimes lacked with their relationship with the healthcare district in the past, and I really think that that you're laying that foundation, in particular in the ones that I've attended, which have been a couple, as you know. You haven't shied away from answering the difficult questions that people raise, and I think that's precisely the attitude you ought to have, and I really admire you for taking that path. So congratulations.
Thank you, Mr. Mayor. Happy holidays.
Thank you for
Thank
coming.
you.